Hi and welcome to Conceive Baby. My name's Tasha Jennings and today I'm here with Dr Joseph Sgroi, obstetrician, gynaecologist, IVF and fertility specialist here in Melbourne. Dr Sgroi is part of the Melbourne IVF group. He's also a committee member and media spokesperson for RANZCOG, the Royal Australian and New Zealand College of Obstetricians and Gynaecologists, and is a member of the RANZCOG Women's Health Committee, which is a leading professional body working to improve outcomes for women, couples, and their babies. And I'm delighted to also have Dr. Sgroi as a member of the Conceive Baby expert panel. Now, Dr. Sgroi, you have an obvious passion for helping couples conceive and carry healthy babies. What got you into specialising in fertility and obstetrics?
Well, obstetrics and gynaecology is by far the best profession to be involved in. It's both a humbling experience to be involved in the journey with women and couples all the way through preconception to the birth of their baby. There's no greater joy than being able to assist couples fall pregnant and women fall pregnant, and then being able to deliver the baby or help in that whole birthing process, and to be able to see grown men cry and to be involved in that whole in very emotive experience is a very humbling experience for me.
So when do you suggest couples seek professional advice for their fertility?
Well, I think any time that a couple or a woman feels as though she needs some advice and or assistance with fertility treatment, she should go and see someone. And it might be very simple things, just concerns with regular periods or pain with periods, or alternatively, the length of time that it's taken to try to become pregnant. So some women might find that after 6 months they're finding that their menstrual cycles are irregular. They should go and see someone a lot sooner. It's really up to the individual person or the couple themselves to seek out treatment and advice when they feel that they need to. And you can do that immediately by seeing your general practitioner, or alternatively referring to a fertility specialist.
So what can couples expect when they do come and see you for the first time?
Well, I think one of the great things about being a doctor first and foremost is the fact that we look at the person holistically. So we look at medical conditions that might impair couples' attempts at being able to fall pregnant. So things like diabetes and thyroid disease, and making sure that they're in check, as well as also looking at things like weight, diet and exercise, and also nutrition. All those components, just on a general perspective, have great impacts in terms of achieving pregnancy and also pregnancy outcomes. But in addition to that, we'll go through what I like to think the 6 things in order to be able to see if there's any impediments to pregnancy. So looking when couples are having sex and making sure that's timed around ovulation. Making sure that the uterus is receptive, a uterus that looks normal, is structurally normal, and there's no impediments to pregnancy. And we'll do that by doing an ultrasound scan and being able to see the uterus, being able to see the ovaries as well. Making sure that the woman's having regular menstrual periods and in fact is ovulating, which is obviously in many cases the only concern that women have. And being able to reverse that by giving medication to help ovulation is often the panacea to be able to get couples to become pregnant. And then in addition to that, the blokes don't get off lightly. We also do a semen analysis and make sure that the semen parameters or the sperm parameters are adequate to achieve pregnancy. And then it's a matter of seeing if there's any identifiable reversible causes that we can finesse in order to achieve pregnancy. And like I said, that might be simple things like just timing sexual intercourse appropriately, to things like medication, oral tablets to facilitate ovulation, all the way through to IVF, with IVF really being the last resort in most cases.
And how important is the couple's preconception health?
There's many studies that show that the outcomes in terms of pregnancy and childhood development are majorly impacted by preconception health. We know that the genetics of the baby are influenced by those genes that are occurring in the parents as well. So a mother that is really healthy throughout her pregnancy and also preconceptionally will have better outcomes, not only in terms of her pregnancy in reducing the risk of diabetes and high blood pressure, but in addition to that, also reducing the risk for her child long term from diabetes and high blood pressure as well. So maintaining a good preconception, good diet, good exercise, also micronutrients as well is going to be key in not only conceiving in the first instance, number 2, having a healthy pregnancy, but number 3, being able to give your child the best start in life, and also to mitigate against the risks of disease later in life for the child.
So what role does diet and lifestyle play in fertility? I know you mentioned a bit about it there.
So there's no doubt that modifying those key elements of diet and exercise, as well as the utilisation of micronutrients in the months preceding conception, are vitally important in the development of the embryo and the development of the baby. And we can modify our behaviours quite easily by maintaining a good diet and exercise, and by also having a supplement that contains folate 1 month prior to and for the first 3 months of pregnancy, to decrease the risks of neural tube defects such as spina bifida.
So just to sum up there, what are the top things you would suggest couples do to help support their own fertility?
One of the things I think is most important is just to relax and enjoy the process of making a child, so to speak. I think nowadays a lot of women and couples get hung up on apps that sort of time when they should be having sexual intercourse, and it's probably not the nicest way really to be able to conceive. So taking some of that stress off by seeking the advice of a medical practitioner or a fertility specialist, and being able to sort of coordinate the cycle and take the stress off, that is the first thing that's vitally important. The next thing is to maintain good diet and exercise, and to, in addition to that, decrease all those modifiable things, stop smoking, decrease alcohol consumption. They're all going to have positive impacts on the ability to conceive, improve semen parameters and improve ovulation. And in addition to that, obviously seeking advice when you need to. That's going to be particularly important for couples who have been unable to achieve pregnancy in a 6 to 12 month period. And by far and above, all those risk factors can be at least modified and quite easily by maintaining good habits preconceptionally, so that it survives the course of the pregnancy itself.
Thanks for your time today, Dr. Sgroi.
No worries, my pleasure, and thank you very much for having me.
You can read more about Dr. Sgroi at his website, drjoseph.com.au, and also at the Conceive Baby website, conceivebaby.com.au.